Now, tibialis posterior tendon problems and tendon dysfunction is a really common problem. One of the problems I see most commonly in clinic, certainly one of the top three. This is the tendon that holds the arch up in your foot and can get injured, certainly causing flattening of the arch and even an adult-acquired flat foot. There are different stages to this, but it is one of the most common things I see. I'm Stapleton, and I'm a specialist in podiatric sports medicine. I've had two follow-ups with two ladies in the last 2 days, one yesterday and one today. Lady yesterday, we were fitting her custom orthoses, and this is a common first-line intervention very often for making people more functional and more comfortable. And we were fitting her orthoses, and she was adamant that she had no pain relief putting the insoles in her shoes and walking across the clinic floor. And I had to reassure her that they would take effect and every chance that they would improve her symptoms, and that with 20 years experience I knew that this should help her without having to change the orthotics, that they almost have to take you have to use them for them to have an effect. She has a tendonopathy, and that's going to take some time to heal. And very often it doesn't take very long to heal. A lady I've just followed up with now, and she was issued her orthosis about 4 weeks ago, and she self-reports a 70% improvement in her symptoms. And this is in 4 weeks using orthotics and particular strengthening exercises. She said that she was astounded by how much a benefit she'd made in such a short space of time, and now she's beginning to enjoy going out for recreational walks and the like once again, and she is finally believes that she won't need surgery for this problem. And I think that's the stark contrast between the two. And the first lady I think she's quite desperate. She's been in pain for a long time and really disabled because of it. And at one point she cried during the clinic, bless her. And I was trying to explain that I've been doing this for so long, the track record, I know that this particular prescription of 3D printed orthotic will improve the vast majority of patients. I have been keeping an audit since the beginning of the year, so January 2025, and I've added up that we have 20 patients that we've followed up with. Now, we've issued for more than that. You always lose patients to follow up, especially in private practice, because follow-ups normally get charged. So we follow up at a certain percentage, and I thought we'd run through just how many people have benefited from orthotics and the self-reported improvement that they've given. So this is on the computer here, that's a bit up close and personal. So if we're looking through here, patients, so with that particular lady, 4-week follow-up, 70% improvement. Next one, 4-week follow-up, no improvement. That does happen. 4-week, 70% improvement. 4-week, 40% improvement. Going through here, 4 weeks, 100% improvement. 3-week follow-up, 80% improvement. 3-week follow-up, 60% improvement. These are all separate patients. Ignoring the adult-acquired flat foot patients. So going up here, 4 weeks, 100% improvement. 4 weeks, 20% improvement. 4-week, 50% improvement. 4-week follow-up, 100% improvement. Another one, 4 weeks, 90% improvement. Up here, 3 weeks, 85% improvement. These are all self-reported improvements from patients. 4 weeks, 50% improvement. So I'll just scroll through this. 4 weeks, 65% improvement. 5 weeks, 80% improvement. 4 weeks, 60%. 5 weeks, 70%. 6 weeks, 0%, and it does happen. 8 weeks, 60%. So it gives you a little overview as to the improvements some patients get. Now, not all patients will respond to orthotics, and especially not in a short period of time. The variables in that, some orthotics might need modification and need more prescription. Some patients just don't get on well with wearing orthotics, but normally they're with a new, more modern 3D printed orthotics, most patients do respond. Some patients require pain-killing injections. Some patients need surgery, and ultimately that's why we have surgeons, because not everyone responds to conservative care. The types of footwear that you put your orthotics in will also change the properties of the orthotic and how effective it can be. There are lots of variables, but we know that most patients there, with 20 patients on that list, and only 2 have had no improvement at between 4 and 8 weeks. All the rest have had self-reported improvements. Now, we often think that tibialis posterior tendinopathy will take somewhere between 3 and 6 months to recover, and therefore the follow-ups here are also at the very earliest stages of that. One of the things we also see with patients that might feel like they get the same level of peak pain, but very often if they've been disabled by their symptoms and unable to continue with normal exercise or normal daily life, that once their pain starts to drop, they continue to exercise to the point that they cannot. So they often end up doing more in the interim for the same pain. Now, we're not looking at lots of those patients having full relief, full recovery from their symptoms in that short space of time, but that wouldn't be what we would expect. Tibialis posterior tendon dysfunction and tendinopathy can be debilitating and disabling. The majority of these patients respond, and this was my point to the lady I spoke to yesterday. I would be very surprised if she doesn't notice some improvements when I follow with her in 4 weeks' time. I hope you found that helps. If you like the video, if you like the video, click like and subscribe, and I'm hoping to upload some more videos about different foot and ankle conditions shortly.